I am an independent attorney. I practice mostly on the eastern side of the Twin Cities. And being an independent attorney, I have some opportunities to do some things that other attorneys don't. One of those things that got my interest about 2 years ago was government intrusion in our lives and the increasing command and control of the population of the government. I've made Data Practices Act requests to the Minnesota Department of Transportation relating to their tracking device system that appears to be being implemented. That's on my blog, nathanmhansen.blogspot.com. I had to sue them last year to get some of those documents. I've made Data Practices Act requests to the City of Minneapolis related to the hundreds of video cameras that Mayor Ryback has put everywhere to monitor the population. This is something that has also caught my interest. I'm not as knowledgeable about all of the specifics as Ms. Braze is, but on July 28th, 2008, this year, I made a Data Practices Act request to the Health Department related to this rulemaking related to these blood spots. And then also, more importantly, what I was interested in was the retention of these data and the transfer of these data to the University of Minnesota and the Mayo Clinic for studies that I don't know what they are or what they're studying or what the components of the data are, or what the contracts are. I received a letter in early September saying that my documents were together and I could come down and inspect them. On October 23rd, 2008, I went down to the Orville Freeman, beautiful building they built, the Orville Freeman building where the Department of Health and Department of Agriculture are, and I spent several hours reviewing documents they'd prepared for me. Absent from those documents were the information I asked related to the transfer of the DNA blood spot information, which I would really like to know about. If the government, I can understand the government taking the data and having a contract with Mayo Clinic to actually do this newborn blood screening. I understand that there are people who have had these diseases identified and have had their children's lives saved. But if beyond that point, if you're retaining the data and you're transferring it for studies, what are you doing with it? I sent a follow-up letter the following day to the Commissioner of Health, Dr. Sandy Magnan, saying thank you for providing the documents, and people were real polite and stuff, but I was missing all these documents related to the retention of these DNA and these studies that were taking place. I sent that the following day, and I said, could you please get these documents because that's included in my original request. I didn't hear anything back. I sent another follow-up request via certified mail on November 18th, 2008. I haven't heard anything back. And then now at this point, I mean, I'm at the point where I was at with MnDOT, where I'm probably going to have to petition for a writ of mandamus in Ramsey County District Court to have this information turned over. And then when I do, what I do with these government documents when I get them is I upload them to my law office website and then host them on my blog and write about them, but then they're just available for the public, for anybody to review. And so that's that. We have a government that's unwilling to even provide just this information, this large, very well-funded government. I find it surprising that they can't answer a simple request. Thank you.